COVID-19 vaccination rates continue to climb and states across the country are opening up their economies. We can finally see the light at the end of this dark tunnel. Now we must learn from the devastation brought on by COVID-19. We know that the pandemic exposed long-standing challenges that American families confront each and every day. The pandemic highlighted the essential value of care, both that supported by a professional workforce and that of unpaid family caregivers. At today's hearing, our witnesses will speak about the caregiving economy, both paid and unpaid, and what is needed to ensure that seniors and people with disabilities have access to the supports that they need. Medicaid home and community-based services enable more than 3.5 million people to remain in their homes, to stay active in their communities, and to lead independent lives. This assistance often includes help with activities of daily living, such as eating, bathing, and managing medications. But too many Americans, likely millions more, are not able to access these services, placing significant financial and emotional strains on families. We know that almost 820,000 Americans languish on wait lists for Medicaid home and community-based services, sometimes waiting for these services for years. That's one reason why President Biden proposed a historic $400 billion investment over 8 years in these essential services as part of the American Jobs Plan. Congress is currently debating the contours of legislation to invest in our infrastructure and fix our nation's long neglected roadways and bridges, just by way of example, obviously other parts to that bill as well. For millions of families across the country, but especially for women, their bridge to work might be a physical bridge, but it may also be the bridge of caregiving bridge, whether it's home and community-based services or whether it's child care or other supports for the family. The President's proposed investment will make it possible for more Americans to receive high-quality services and supports. It will allow them, this investment will allow them to live in their own homes, participate in their communities, go to school, and hold a job. It will help family members who are often the unrecognized and unpaid caregivers, providing support every day. This investment is also about services, but it's definitively about jobs. We must turn these jobs into good quality, family sustaining jobs. In Pennsylvania, for example, the median wage for a direct care worker is just $11.99 per worker, or per hour, I should say. And many have few or no benefits, those in this workforce. So we'll hear today, the majority of these workers are women and from communities of color. Among home care workers, 62% are people of color. An investment in these essential workers is long overdue. A little over a month ago, I spoke to Lisa Savage from Philadelphia. Lisa left her career of more than 20 years to be a home care worker in order to support her son, Brandon, who was shot and left paralyzed while at home on a break from college. Lisa Savage said the following to me, quote, "As a home care worker, we are essential. We're essential because we care for the elderly and we care for people with disabilities at home," unquote. Lisa's right. An investment in her essential work is critical. And an investment in home care workers across the country is long overdue. So I look forward to hearing from our witnesses today about these important issues. But before we begin, I want to remind committee members and witnesses to please keep your remarks and questions to 5 minutes. We have a countdown timer that can be viewed alongside the other participant windows on WebEx. So following opening remarks, senators will ask their questions based on seniority, and I ask that members have their cameras turned on a few minutes prior to their questions. So with these logistical notes, I turn to our ranking member, Senator Scott.
Thank you, Mr. Chairman, for holding another really important hearing for those of us who are all very concerned about our aging community and the way in which they age, the care that they receive. I had the good fortune, and still have the good fortune in many ways, to be being raised by a single mom who was a caregiver. She spent 40 plus years as a nurse's assistant in hospitals caring for our elderly patients. Having an appreciation for the hard work, the struggle of caregivers is something that I grew up watching and experiencing. The truth is, Mr. Chairman, I think you and I would both agree that caregivers need to be celebrated today coming out of the pandemic in a way that we've never, ever celebrated them. And too often, too many of them are working for too few dollars in their paychecks. Having been raised with my brother in that household, I will say that the one thing that I would never, ever change is that the compassion and the sensitivity that my mom learned through being a caregiver made me a very different person and made my brother a better person. And frankly, it is that important part of caregiving that you can't buy. You just can't buy people who love and care for the patients as my mother did and so many others do today. We think about people that we know first, and I think about Claudia Bentley in my Charleston office and Kathy Crawford in my Charleston office, who both are caregivers. Claudia's husband, Ed, suffers from Alzheimer's, and she basically has at least 2 full-time jobs at the exact same time. Kathy has cared for 2 elderly aunts into their 90s in her home, and then her mother-in-law, who passed away, unfortunately, just last week at 91 years old. Kathy and her husband moved the mother-in-law into the house so that they could provide high-level, high-quality care for the ones that they love the most. I think it is one of the best things we can do is take care of those that took care of us when we could not take care of ourselves. From 2008 to 2018, the population over 65 years of age grew from 39 million to 52 million. By 2060, that population will be 95 million people. That's a lot of folks that will need a high level of care. My concern with the president's approach to this issue is just throwing money at the issue won't solve the problem of quality control. It won't solve the problem of family members being able to take care of their family members. We can't use a one-size-fit-all plan. It's one of the reasons why I will release today a white paper, a discussion on a better way forward, a way that allows for us to look at the unique opportunities within family systems and our other apparatus to provide the type of unique programs and care provision that our seniors want and deserve. The truth is that having our seniors spend all their assets down to be eligible for Medicaid makes it very difficult for us to have intergenerational wealth created, especially in those communities where their net worth is or wealth is 8 times lower than the rest of our country. So we have to make sure that we focus our attention on programs that do not require us to see the resources depleted before you're even eligible for assistance. I think there is a better way, and our focus on that better way is going to be the focus of our attention on providing a flexible, tailored program that allows for caregivers to be appreciated, celebrated, and allows the family members who need the help the most to have access to resources that allow for their lives to be the best. I'm a big believer that the latter rain should be better than the former rain, as we've learned in the good book. So with that, Mr. Chairman, I look forward to hearing from our witnesses. I thank each and every one of you for being here today, and I look forward to having a robust discussion on ways for us to improve the quality of the outcome of those we love the most.
Ranking Member Scott, thank you for your opening. I will now turn to our witness introductions, and I'll start, and I'll have the first, and then I'll turn to Ranking Member Scott for the second. Our first witness is Ai-jen Poo. Ai-jen is the co-founder and executive director of the National Domestic Workers Alliance. She's also the co-founder and director of Caring Across Generations, a coalition of organizations working to strengthen the caregiving infrastructure for America's families. She is a recognized expert in family and elder care and has been chosen by Time Magazine as one of the 100 most influential people in the world and was a recipient of a MacArthur Genius Genius Award in 2014. Ranking Member Scott, I'll turn to you for our second introduction.
Thank you, Mr. Chairman. It's my pleasure to introduce today an individual who has, I will say, I was going to read from my prepared remarks, but let me just say this first. Stephanie Blunt is a champion of people who need a little help. People who want to be independent, people who have passion for life, people who are still in the prime of time, in the prime of their lives. And Stephanie, for the last 20 years, has literally dedicated so much of her life to helping seniors throughout the metropolitan Charleston area, as well as the state as a whole. She is the executive director of the Trident Area Agency on Aging, where she has worked, as I just said, for more than 20 years. In her capacity, she provides oversight for federal, state, and private funds used for serving seniors and family caregivers. She also leads development of strategic and operational plans in support of the agency's mission. Stephanie's testimony today is based on her experience working with older Americans and their caregivers. We'll hear about the pivotal work she has done to support our most valuable citizens. Stephanie, we appreciate your hard work, your dedication to the seniors in our state and in our low country. She has been in the nonprofit world from my days in the nonprofit world back in the early 2000s. So God bless your efforts, and may you continue to have strength and good health.
Thank you, Ranking Member Scott. I'll now turn to our third witness, Brittany Williams. Brittany Williams, I want to say, first of all, thank you to Brittany for being with us today, but also for being so patient as we navigated some technology challenges. I'm glad you're able to be here by phone, and we'll be able to post your picture with the audio when it's your turn to testify. So we're grateful. But Brittany is a professional home care worker in Burien, Washington. She's a third-generation caregiver who began work as a home care worker after watching her mother and her grandmother do the same work. She's also a member of Service Employees International Union, Local 775. And then finally, our fourth witness is Theo Bratty. Theo, someone I met a couple of months ago when we were talking about these issues in the midst of the pandemic. Theo is also a Pennsylvanian. I don't mind mentioning that. He's currently a consultant working in the area of disability and nonprofit management. For 31 years, Theo was the CEO of the Center for Independent Living of Central Pennsylvania, and also helped people with disabilities live where and how they wish. Theo is a person who has lived with a disability since he was 15 years old and has used home and community-based services for more than 4 decades. So Theo, we're grateful that you're with us today. And before I start with our witness statements, I wanted to acknowledge Senator Rosen is with us. And as I often mention during our hearings, we're going to have senators who will be in and out going to different hearings. But we'll wait for some to get back to do questions. But I want to acknowledge those who were here early, and then we'll go from there. But let's turn to our first witness, Ai-jen Poo, for our first statement.
Chairman Casey, Ranking Member Scott, and distinguished members of the committee, thank you for the opportunity to testify today. At Caring Across Generations and the National Domestic Workers Alliance, we've worked for over a decade to bring attention to the urgency of investing in Medicaid, home and community-based services for older adults and people with disabilities. We now have a once-in-a-generation opportunity to invest, to build the 21st century care infrastructure we need. Caregiving is personal to me. My own grandfather, who helped raise me, taking me to and from school, teaching me the values of hard work and respect for my elders, values that shaped who I am today, had to be placed in a nursing home against his wishes when he lost his vision and we could not find home care assistance. He shared a room with 6 others, many who were crying in misery. He couldn't eat the food or sleep. The staff was overwhelmed with too many people to care for, and he passed away after just a few months, fearful and a shell of himself. While this is my own story, it is certainly not unique. 88% of aging adults prefer to receive long-term services and supports in the home and community-based setting. But these services are out of reach for too many. Across the United States, nearly 820,000 older adults and people with disabilities are on waiting lists for Medicaid HCBS. People wait years, sometimes decades, for access to services. There are home care deserts across the country, especially in rural communities. And we are facing an elder boom. By the year 2050, the population of people 65 and older will nearly double. With 10,000 people aging into retirement per day and living longer, there's an overwhelming demand for care in the home and in the community. And to age at home, we need infrastructure, including a strong direct care workforce. From 2018 to 2028, the US will need to fill over 4.4 million home care job openings, making home care one of the fastest growing occupations in our economy. But the average annual income for a home care worker is $17,200 per year. The median hourly wage only increased by a total of 91 cents between 2009 and 2019. 1 in 8 direct care workers lives in poverty, and 3/4 earn less than a living wage in their states. This essential workforce of women, majority women of color workers who we are counting on to care for us, can't care for their own families doing this work. The proposed investment of $400 billion for HCBS and the American Jobs Plan will jumpstart economic recovery in a number of ways. First, according to one estimate, the $400 billion would create nearly 800,000 new care jobs and over 1.1 million new jobs overall each year over 10 years, adding an estimated $40 billion in new income to American families every year. Second, it will raise wages and offer real economic security for the direct care workforce so they can sustain in the profession, work that cannot be outsourced or automated, and one that has faced legal exclusion from basic protections for generations because of the devaluing of caregiving, and largely due to racism and sexism. This is a powerful way to directly create good jobs for women and women of color to be a part of our economic recovery. And third, by expanding access to services, the plan will allow for people with disabilities to live independently, to work, and live full lives in the community. It will enable quality of life and better healthcare outcomes for older people, including people with chronic illnesses like Alzheimer's, who want to live at home, connected to friends and family. Expanding access to services and a strong workforce are interdependent goals that go hand in hand. And finally, it will support the 48 million family caregivers who are also majority women who have long struggled to manage work and caregiving. The pandemic pushed nearly 4 million women out of the workforce due to caregiving challenges. Our recovery must enable them to have the real choice to go back to work. The care economy is the foundation of the entire economy. From childcare to paid leave to HCBS, when we invest in care, we invest in opportunity for all. An investment of $400 billion in the American Jobs Plan and home and community-based services is an investment that cannot be shortchanged. Thank you so much.
Thank you, Ms. Pu, for that testimony. And before we move to our second witness, I wanted to acknowledge as well Senator Blumenthal and Senator Rick Scott. And next we'll have Stephanie Blunt. You may begin.
Chairman Casey, Ranking Member Scott, members of the Senate Special Committee on Aging, it has been an honor to serve in the South Carolina Aging Network for the past 20 plus years, both at the local service provider level and at the Area Agency on Aging level. Trident Area Agency on Aging is one of 10 area agencies on aging in the state of South Carolina, designated by the South Carolina Department on Aging. Since our organization was formed in 1991, we have worked within both the public and private sectors to develop a cost-effective approach to long-term care services. We serve as the resource connection for seniors, adults with disabilities, family caregivers, and professionals. I lead a staff of over 15 who have daily contact with seniors and their families. Annually, our staff and volunteers serve over 12,000 seniors and 1,500 family caregivers. It is my responsibility to, work within budgets, adhere to regulations, follow policies and procedures, but at the end of the day, it's about making all of those factors connect with the people who need our assistance on a daily basis. Since 1965, the Older Americans Act has been a solid foundation for aging services throughout our country. And my years of experience have taught me how to cobble together federal, state, and local resources to meet the needs of a very growing and diverse aging population. States, regions, and counties are all different. And it is a waste of resources to collect needs assessment data year after year and not be able to really offer the services and supports that will prevent seniors from going into the hospital or seeking long-term care placement. While the Older Americans Act is designed with some local flexibility, there are still restrictions on which sets of funds we can use to fund which services, and that presents a challenge. So area agencies on aging, we need flexibility at the local level so that we can determine how those funds are to be spent and spend those funds how seniors need them. Since 2001, our Area Agency on Aging has offered, through the Older Americans Act, the National Family Caregiver Support Program services. We have seen firsthand the challenges that many caregivers are facing, particularly the working family caregiver. Our staff receive calls from stressed out family caregivers on a daily basis who are trying to juggle their full-time employment, as well as their families and their caregiving responsibilities. Through the Family Caregiver Support Program, we're able to provide information, connect caregivers to resources, offer education like dementia education, and offer respite services. The respite that we do provide is helpful to so many caregivers as it gives them a break. In South Carolina, the average respite assistance is valued at about $2,000 annually, or providing about 90 hours of assistance per year. While this is very beneficial to so many caregivers, it does not meet the ongoing needs of the working family caregiver. Our country's affordable healthcare options, they're difficult. Our long-term care system is fragmented. And so, families are seeking affordable care options. In addition, we need more investment in the more fiscally responsible home and community-based service options. The lack of workforce in the home care industry continues to be a barrier in providing respite services and home care services. We rely heavily on these direct home care workers to perform light housekeeping, help with personal care, and also provide, meal preparation. Because we want to have these services in place because we want to keep seniors out of long-term care placement. And so unfortunately, hiring these direct care workers is a challenge. In my region, I surveyed some of our providers, and the pay is anywhere from $10 to $17 an hour. But that $17 an hour is not the norm, because that's based on their years of experience in the field, the certifications they have, and the level of care that they're providing. So we really need to increase compensation for these direct care workers. They're so essential to our system, and enhance the rates for community-based service providers who are funding or who are employing these individuals. So I just again want to thank you for the opportunity to speak with you this morning, and just allowing me to share my experience on serving older adults, people with disabilities, and also our most important family caregivers. Thank you.
Ms. Blunt, thanks for your statement. And we'll turn next for our third statement from Brittany Williams. Ms. Williams, you may begin.
Good morning, and thank you, Chairman Casey, Ranking Member Scott, and members of the Aging Committee. My name is Brittany Williams. I live in Burien, Washington. I'm a home care worker and proud member of SEIU 775. We represent over 45,000 in-home caregivers in Washington and Montana. Home care workers have helped seniors and people with disabilities live with dignity and independency in their homes. I currently take care of 3 clients, providing essential life-sustaining care such as bathing, cooking meals, cleaning, helping them go to the bathroom, running errands, and anything else they may need throughout the day. Caregivers isn't just a job for me. It's in my genes. I grew up watching my grandmother and my mom do the same work. While I was in school learning my ABCs from my teachers, I also learned an invaluable lesson of compassion and care from my mom and grandma. Even as a child, I could see the care is essential. It is giving life work that I am blessed and proud to do. But this job is hard. I always say that home care workers are the maintainers of life, but we can barely survive ourselves. That is the way it's always been for home care workers. Black women like me have been caring for this nation for centuries, but due to the long history of racism and sexism, our work has been labeled as unskilled women's work. And that narrative has been used to devalue us and hold us back. Home care is one of the lowest paying jobs in the country, and where many lack access to benefits. I'm a single mom of 2 amazing children, but I worry about letting them down. My family has to budget every penny and save wherever we can for emergencies. I struggle to meet our basic needs like paying our bills, putting food on the table. I simply can't afford to give my children some of the opportunities their peers have. And if things weren't bad enough already, the COVID-19 pandemic ran us into the ground. Everything that I thought was secure, the pandemic took away. It took away the security of having a safe place with my children to learn. It took away the security of working enough hours to earn what I need to provide for my family, and it took away the security of having a roof over my head. I became exhausted and angry at the injustice of it all. A global pandemic, economic turmoil, and on top of all of that, the racial violence. I stayed strong, and I did what I had to. But I'd be lying if I say I wasn't scared for my life and the lives of my family and clients each and every day. But thank God for my union, SEIU 775. Together we have won higher wages, better benefits. Now Washington home care jobs are among the best in the nation. But the victories are bittersweet because not every home care worker is in my position. Like my mom down in Arkansas, she doesn't have a union, and she earns just $11 an hour. We need to fill nearly 5 million home care jobs by 2028. The low quality of these jobs force people out of the industry and leaves shifts unfulfilled and clients without caregivers. Our country needs a care wake-up call, and that is why we support the American Jobs Plan. This investment in care will be life-changing. It could transform home care jobs into family-sustaining union careers so we can build the workforce we need to meet the growing demand for care. This investment will help build back a more inclusive recovery, lifting millions of women, Black women, women of color, immigrants out of poverty, and at the same point in our lives. And we all will need this kind of care at some time. And it's not fun to think about, but everyone deserves the comfort of knowing a skilled and dedicated caregiver will be there when the time comes. If you or your family member suddenly needs a home care tomorrow, are you confident you will be able to get the resources and services you need? Are you confident that your constituents could do the same? I suggest you do not wait to find out. Care cannot wait, and neither should Congress. Thank you.
Ms. Williams, thank you for your statement. And now we'll turn to our fourth witness, Theo Bratty.
Again, first I'd like to thank you, Chairman Casey and Ranking Members Scott and the members of the Special Committee on Aging for inviting me to chair. And I also like to thank all the panelists, but I'd certainly like to thank the young lady that just spoke, the home care worker. I feel your pain. My name is Theo Bratty, and I became a person with a disability at the age of 15 after breaking my neck playing high school football in Watley, Georgia. I'm originally from Georgia, and I'm 61 years old. I retired early in 2019 after working 31 years as the CEO of the Center for Independent Living of Central Pennsylvania. Our mission is to eliminate and prevent barriers that are faced by people with disabilities on a day-to-day basis. I'm married. I have a 28-year-old daughter and a 23-year-old son. I now work part-time as a consultant. But most importantly, and assuredly, for this hearing, I am a user of home and community-based services. That is very important. And I have used home and community-based services for over 3 decades. And as I share my story, Senators, please understand that this is not only my story, but it's a story that has lived out for millions of people across this country, including the young lady that just spoke, the home care worker. Disability, what we don't know is when it can happen. It happened to me playing high school football, game I loved. It happened to Christopher Reed riding a horse. But what we do know for sure that life will change when it does. You'll be faced with all types of new barriers in life. And that turning point was at age 15, 46 years ago. At age 15, my life changed. I became paralyzed from the neck down. And I couldn't do anything for myself. Now, I usually don't talk about this, but for the purpose of this virtual meeting, I need to really describe to you that my disability is significant. I'm paralyzed from the neck down. I virtually can't do anything for myself. I have spent 46 years in a wheelchair. And if I could spin around and pull myself from these earphones, I would show you, because you need to know my situation. I can't move my fingers. I don't have any dexterity. I don't have any triceps and muscles. I have biceps, but I have very little movement. I can't get in and out of bed. I can't dress myself. I can't undress myself. I can't even bathe myself. Life changed for me. It became what I refer to as a maze of confusion. I ended up in a nursing home. And a young lady that said something about the crying and misery. I remember when I was 15 years old, not being able to sleep because people were just crying all night long. And the weight of all of this came on my family because I spent that time, a year, in a nursing home. Because when I came home from rehab, we were dirt poor. My mom couldn't help me with anything, so the only option was for me to go into a nursing home, and I spent a year in a nursing home. And that crying, that misery, it haunted me. Fortunately, like most people with disabilities, my family came in, and my brothers and sisters, they brought me into Pennsylvania. And I ended up on the 3rd floor in an apartment building, looking out a window for weeks at a time, waiting for my brothers to come over and carry me down 3 flights of stairs and then back up again. And that went on for a long, long time. I have no way of explaining how it feels not to be able to do anything for yourself anymore, having to depend on family members or the kindness of strangers. Because sometimes strangers are not kind. I remember one time when I was trying to put money into a parking meter, and a stranger came by. I was waiting on someone to come by to help me put the money in. And he looked at me as I asked him to help. And he said I didn't have time for that. And he kept on walking. So we can't always depend on the kindness of strangers. Home and community-based services changed all of that. It started when I received attendant care services. I said this many times before, people with disabilities do not want to be taken care of. They don't want to be seen as objects of charity. We want to contribute. HCB services, especially attendant care services, did that for me. I call it the Great Equalizer. There are many times throughout my 31 years of work when I had to depend on attendants to drive me back and forth to my many meetings because it was just too far or just too painful for me. Being provided with attendant care gave me back my independence and my ability to live life fully again. Once I started receiving home and community-based service, I enrolled in Edinburgh University and received my earned bachelor's degree. And then I moved to Philadelphia Temple University and received my master's degree in social work with honors. And this was done based on one time OVR counselor telling me I wasn't college material when I told him I wanted to go to college.
Pros.
Right. In undergraduate school, for the first time in my life, I was able to move off campus and live by myself and use attendant care services. That's something all students want to do. Shortly after finishing my MSW, I worked with a small group of Central Pennsylvanians, people who wanted to apply for a grant to establish what was a major thing at the time, Center for Independent Living. Once that grant was approved, I became the director for 31 years, like I said. I have taught as adjunct professors at Milledgeville University, at Temple University as well, and lectured all over the country. I have been appointed to serve on boards by 3 different governors. And as a result, I have impacted many lives for the better. All along the way, my different attendants helped me get in and out of bed, went with me as I needed, not 24/7, but just as I needed. This is what attendant care is all about. This is what home and community-based service is all about. And this is what I want you to take away, Senators. Don't miss this. All the
Theo,
time.
I just want to jump in. We're over time by more than 2 minutes. So
I am so sorry. I am so sorry.
I just want to make sure we can get to our questions, and I hate to cut you off.
Nope, that's fine. That's fine.
We might be able to develop more of it during questions. I know that we're juggling senators who are in and out, so I'm going to cede my question time to Senator Blumenthal.
Thank you so much, Senator Casey, and I am so grateful to you for having this hearing and for your championing this cause of home and community-based care. You have been just such a steadfast advocate. And I really want to thank this panel. You know, we hear from a lot of witnesses. I had 4 hearings and meetings this morning. A lot of it happens at the same time, but sometimes a panel really cuts through to your heart. And this panel, Ms. Brady, thank you so much for that really eloquent testimony. Thank you to Ms. Williams. You know, SEIU, we owe that union so much because they have really helped protect the home care workers in a way that Congress has failed to do. You are right. and I'm quoting you, "Care cannot wait, and neither should Congress." And that's why many of us feel, like Senator Casey, that this kind of home and community-based service should be part of our infrastructure package, has to be a part of what we do. In Connecticut, we have 500,000 family caregivers. Let me repeat, 500,000 family caregivers in a state with a population of about 3.5 million people. That's a sizable part of our whole population. They are people who are families taking care of members of their family. They are people like Ms. Williams working professionally. They are people like the attendant who is taking care of Mr. Brady. And they have been going through unprecedented stress, anxiety, hardship, physical labor. So this kind of lost wages, missed opportunities, unparalleled stress cries out for action for the sake of the people who they care for as well as themselves. So let me ask Ms. Pooh, you've spoken a bit about the impact of unpaid caregiving on families, mentally, physically, and financially. And Mr. Brady, you've shared your experience receiving care from family members before HCBS. Maybe I can ask you, how important is the support that we provide unpaid caregivers, the tools, the training, the support they need? And I just want to mention that I have introduced today the Alzheimer's Research and Caregiver Trust Fund Act, which Americans would be able to donate to through their annual tax returns. The donation would then be directed toward NIH and the Administration of Community Living to support and train caregivers. So I think we have coming together of all these different ideas. And let me ask you, Ms. Pooh, how important are the tools and training to the caregivers, the family caregivers?
Thank you for the question, Senator. And it is absolutely essential that we support our family caregivers. And frankly, care in America is an all hands on deck situation. We need to support our family caregivers. We need to support our professional caregivers. And frankly, there will be a lot of family, friends, and neighbor care that we will rely on as well. It's often posited as an either or. And in fact, we need to support all. A strong workforce and families. And we know that almost 20% of family caregivers have quit their jobs because of caregiving. And 70% of family caregivers are forced to make work adjustments like cutting back on hours or turning down a promotion. All of this can result in lost wages, diminished Social Security earnings, jeopardizing the overall economic stability of families and communities. So we do need to support family caregivers. And I also want to highlight the sandwich generation, those who are both raising young children and managing care for aging loved ones or loved ones with disabilities. They're in a particularly difficult position and really do need support.
What percentage have been forced to leave their jobs?
20%, sir.
20% and 70% adjusting their work schedules. And you know, my time has expired. I really want to thank you, Senator Casey. You've been very, very gracious. And again, thank you for having this hearing.
Thank you, Senator Blumenthal. I know we're joined as well by Senator Kelly, and I'll turn to Ranking Member Scott, but I do want to make reference to the fact that we've had some technical issues. So we're trying to work them out, but want to turn to Ranking Member Scott for his questions.
Thank you, Mr. Chairman, and you seem to be handling the technical issues seamlessly. Most of us can't tell, so thank you for your hard work behind the scenes. Ms. Blunt, once again, just thank you for your dedication to caregiving throughout South Carolina and specifically in the Low Country. I know that you recognize that by the year 2030, our small state will have 1.8 million South Carolinians who are probably going to need a higher level of care than they currently do right now. Can you tell us how your partnerships with local businesses and community leaders benefit seniors? One of the challenges that we have is sometimes this one size fits all says that the government is the only solution. It certainly has to play a significant role, but it can't be the only way forward. We're going to have community leaders and partnerships that provide some bridge to our seniors. Can you talk just for a few minutes about, or however long you want, on that topic?
Thank you, Senator Scott. Sure. I tell you, partnerships are vital and essential to the Area Agency on Aging Services. And the Older Americans Act provides that framework for us to engage in those partnerships. And that is so critical. For instance, let me just give you an example. You know, we receive on a daily basis intakes and provide assessments for seniors who are reaching out to us for services like home delivered meals. Well, it does no good to end a call knowing that a senior is hungry and saying, okay, I'll put you on a waiting list for services. We're able to operate a food pantry here, and that's because we have local partnerships in our community with private businesses and our Low Country Food Bank. So we can provide seniors with basic food to get them through until we're able to connect them with SNAP resources or get them added to services. Another partnership I just want to highlight, you know, even with the City of Charleston, Mayor's Office on Aging, you know, I cannot, you know, this past Tuesday was World Elder Abuse Awareness Day. And, you know, we highlighted elder abuse awareness because that is a huge issue in our communities. And, you know, we want to make sure that we are training, you know, through that partnership. It was a grant that we received, and we were able to train police officers on how to investigate elder abuse. And so those partnerships are so very, very critical. I can talk about them all day long, but again, you know, it's us pulling together. No one entity can do it by themselves. And it really takes all of us working together to meet the needs of a growing and diverse aging population.
Well, Ms. Bunny, you bring up another question for me. In your testimony, you talk about the frustration of trying to manage multiple funding streams and programs that all focus on caregiving for senior Americans. How can Congress play a role in fixing this convoluted system, as well intended as it is? It's a little inefficient in its delivery system and meeting the needs at the user level.
Sure. So the Older Americans Act, while it does provide some flexibility, you know, we do find that it's, you know, we have fragmented services, you know, like in South Carolina, we try to partner and work with our Medicaid agency. You know, the area agencies manage the Older Americans Act services, and then of course the Department of Health and Human Services manages the Medicaid waiver program. You know, we want to avoid duplication, so it's so important that we're working together to make sure that we're maximizing all of our resources in our community. With regards to the Older Americans Act, for instance, with home delivered meals, as I discussed, you know, we have a growing waiting list for home delivered meals in our region. And sometimes the money is given to us in you know, two subparts of the Older Americans Act. And so being able to maximum, you know, have transfer, you know, to increase transfer capacity, rather than having people sit on a waiting list, you know, we should be able to provide services if the money is there. We should be able to help people and get them off the waiting list, because like I said, no senior should be hungry in our community.
Yes, ma'am. Well, I know I'm about out of time, so I'll make a statement as opposed to asking a question. You can just shake your head if you agree or disagree. But in South Carolina, I think around the country, the truth of the matter is that as you wrestle with the streams of resources that may or may not be available, that's one convoluted system itself. According to a survey, 77% of respondents in South Carolina were unaware of Get Care SC website, which would allow for a site that aggregates the information that could help caregivers and the folks that they care for understand what's available. So knowledge is power. We simply need to also make sure that we have a strong marketing network to help people understand what's even available in some instances. So thank you, Mr. Chairman.
Thank you, Ranking Member Scott. I'll have a round of questions, or one, I'll take my round of questions now. I wanted to go back to Theo Bratty. Theo, I didn't want to cut you off earlier, but yours, like so many stories we're hearing today, is a compelling story about the benefits of home and community-based services as a leader in this field. But in your testimony, you talked about how about your reference in both the written and the statement you made earlier about when you're on that third floor of an apartment building, looking out a window for weeks at a time, waiting for your brothers to come over and physically carry you down 3 flights of stairs. So you've seen it up close. You've
Senator, you are cutting out. I missed that question.
hear me now?
I can hear you now.
Okay. I was saying you're both an expert in the area, but also a consumer of the services. So my question is, do we need to expand home and community-based services? And do home care workers need better wages and benefits, in your opinion?
Yes, yes, sir. Yes, sir. And again, I apologize for extending my time there. I got a little carried away, so I definitely apologize for that. But yes, it's really about time. All right, we have talked about this for a while. It's about time for us to recognize that home care workers, attendant care workers, personal care workers, whatever you want to call them, are valued in this community for families. And we definitely need to increase their wages. So we need to make it more available, even more so, Senator and committee members, in this COVID-19 period, where we are already seeing a shortage of home care workers who are not vaccinated, and sometimes choose to be not vaccinated. And so I've already experienced people not being able to get services because of that. So yes, we need to increase that hourly rate immediately.
Well, thanks very much for your insights. I wanted to turn to Ms. Williams. We know that home care work is essential. We've all said that today in one way or another. We also know, and you know personally, that it's demanding work. Too often workers like you who provided this kind of care don't see their work valued the way it should be. In many parts of the country, the home care workforce is characterized by, unfortunately, low wages, limited access to benefits, and very, very high turnover. And that's not good for anybody. This occupation is among the fastest growing in the United States as the aging population is steadily increasing demands for services. So in order to meet the demand for services, we need to ensure that the workforce exists to provide that care, and that these are good jobs that pay middle-class wages. So, Ms. Williams, how important is it that we turn care work into a stable middle-class career for home care workers across the country?
Thank you for that question. I really want to say it like this. You know, investing in caregiving is an investment in our communities. When we have those strong and stable home care careers, we are literally making a way for those family members who would have not been able to work, whether they are your doctors, your lawyers, your garbage workers, your teachers, your firefighters, police officers. We're allowing them the ability to go out and work. And at the same time, we're allowing those consumers, our clients, the ability to still have dignity throughout their lives. And we want to make sure that we are making it a career instead of a job, so that the future people that will come into this field will have something to look forward to. And it also causes an interest into what will be a door opening towards the medical field, because once you feel that compassion and that love and you see that smile on a person's face after a day of work that might have been draining on the caregiver, but it was fulfilling for the client, it becomes an awe moment of, okay. And to look at your paycheck at the end of the 2-week period and see that my family is taken care of. I was able to put back into my community because I was able to buy a home. I was able to put back into my community because I was able to go to the grocer, or I was able to pay my bills. That is why it is essential to make it a career middle class field.
Thanks very much for bringing your personal experience to this. I know my time period is over, but by way of the clock. But I know we're juggling both senators coming in and out, and also some senators trying to connect, and they're having some technical difficulties. So I could turn to Ranking Member Scott again, or I could
Yes,
ask
sir.
a couple more questions.
Happy to ask a question.
Okay.
Mr. Chairman, I didn't give Ms. Blunt an opportunity to talk about the Get Care SC and the importance of having a portal where people can go and get information in one site. And so, Ms. Blunt, as opposed to asking you to nod because I was running out of time, I apologize. Now we have more time, so I will go back to you with the really important question about the dissemination of information that is critical for our seniors and their healthcare providers to have access to. I think if that survey is right, at 77% of respondents were unaware of the fact that there was a place that they could go to get more information. That seems to be a really important part of this puzzle. Would you speak about the importance of having that one-stop shopping for this really important issue?
Absolutely, yes. Thank you for the question. First of all, sometimes family caregivers don't even know they can ask for help. So it is important to have a resource for them that they can access very easily at their leisure. Because again, like I said, they're juggling so much. They're juggling their family and their full-time employment and their caregiving responsibilities. So we need to kind of meet them where they are. And so I know we've also worked outreach, I will tell you, is so important. And we've been working on an educational platform. Thanks to, we have our National Association of Area Agencies on Aging that, promotes best practices throughout the country. And so we are connected and trying to get together an educational platform for our family caregivers. So again, they can access that portal and get quality training, accurate training. It's so important that they get accurate information so that they can provide better care for their loved ones and access and connect with the resources in the community. And again, we're trying to think differently, think of new ways and innovative ways to serve our seniors, partnering with organizations to do even more outreach. And I tell you, since the pandemic, we're learning to master this virtual platform. But I will tell you, I think the challenge in that has been connectivity. Because like in our rural areas, not all of our seniors and family caregivers have access, to broadband. So that kind of makes it a challenge for us. But again, we're happy to start to get back out in our communities now, partner with our faith-based organizations, and to continue promoting Get Care SC and all of the services that are provided at the Area Agency on Aging level.
Ms. Blunt, you just raised another really important point that I was not going to ask about, but it seems like this is a really important part of the conversation: innovation and technology. There's no doubt that Harris poll suggests that 8 out of 10 Americans really like or love telemedicine, virtual medicine. I'm thinking back to a different day when my mom, as I've already said, spent 40 plus years. She's still working, but no longer the nurse's assistant that she was. But 40 plus years as a nurse's assistant providing care. And then her aging parents needed care. And so my mother and my aunt both had to take care of my grandmother in her home, and then later my grandfather in his home. And truth be told, getting the loved one to the doctor back, getting off work, doing split shifts at work so you can work 4 hours in the day, take 3 hours in the afternoon to go to doctor's appointments or come in later. Telemedicine really could provide a higher quality of experience for the caregiver and the patient. Any thoughts on that from an innovative standpoint? I will say that I visited Sally, South Carolina, my grandfather's hometown, and broadband, high-speed broadband is an issue. So certainly connection issues is something we need to work on as well. But telemedicine seems to reduce the burden on the caregiver and increases the quality for the patient.
It sure can. And, you know, like you said, bring in the family caregivers, because sometimes you have family caregivers in multiple states who want to be involved in what's going on with mom and dad. So yeah, absolutely bringing families together so they can help to coordinate care and coordinate not only the services, but of course their health care is so very important. We just need to make sure whatever platform we're using is user-friendly,
Yes, ma'am.
senior-friendly, that they're able to again, access it. And again, just making sure, you know, specifically transportation, that's a whole nother topic. But again, it would be important because, you know, so many seniors lack transportation. And again,
Yes,
I don't want to go down that rabbit hole, but.
Chairman, I'm going to just close to this comment. I'll give it back to you, sir. That is a rabbit hole that we need to go down at some point. I served on the United Way Board of Directors for the Tri-County area, and I will say that we spending a lot of time working on programs and projects to help seniors make it to their doctor's appointments, but also getting your hair done. I mean, there are a lot of things, the quality of life, that the experience itself is limited by transportation. So there are some fairly creative ways to help seniors be able to afford and have access to ride-sharing services and or make the whole process easier for seniors. It's something that we don't always think about, especially in cities in the South where transit isn't an option, honestly, for most seniors. And so you have to have a creative, innovative way of providing that resource, the conduit to get to and fro. Thank you, Mr. Chairman. Sorry I went over by a minute or so.
That's quite all right. We're doing a lot of juggling. Ranking Member Scott, thanks very much. I'll start with more questions. I might be interrupted if we have a senator that's connected. We've had some issues, some senators having difficulty connecting, but if they do get connected, I'll interrupt my questions. But I wanted to turn to Ai-jen Poo for a question regarding the workforce. Again, we keep coming back to this issue of who's doing this work because it's so important to highlight. We know that the workforce that provides these services, home and community-based services, are majority women. That doesn't surprise anyone, but also majority women of color or workers of color more broadly. This has been the case for far too long. We know that family caregiving responsibilities have more frequently fallen to women, often pulling them out of the labor force more often than men. Can you speak about the importance of investing in these services from a different perspective here for the purposes of this question, from the perspective of gender equity, but also racial equity?
Yes, Mr. Chairman, thank you for the question. Raising the pay for home care workers would disproportionately benefit women who make up 9 of 10 workers in the home care workforce. It would also benefit the 63% of home care workers that are Black, Latinx, Asian American, and Native American. According to the Groundwork Collective, 68% of Black and Latinx caregivers said that family caregiving responsibilities impacted their ability to work, 10 percentage points higher than white caregivers. Women of color already face obstacles in accessing higher paying jobs and quality jobs, including occupational segregation and discrimination. Also, investing in HCBS would increase women's labor market participation, which is a key factor in a healthy economy. millions of women, as I mentioned earlier, were forced out of the labor market in 2020, in large part due to family caregiving responsibilities. And as a result, we have the lowest female labor participation rate since 1988. So these investments would really support Black women and other women of color who were among those hardest hit through the pandemic.
Ms. Booth, thank you for your response to that. I'm going to turn back to Theo Bratty. Theo, in your testimony, you talked about how when you first became paralyzed in that football injury that you had, all of the caregiving responsibilities fell to your family, which is, I think, a reality for many American families. They go through similar experiences when a loved one develops a disability or when an older relative needs more assistance. While some family members are able to provide these services, others cannot, and often places significant financial burdens on families as individuals to give up their jobs or work reduced hours to provide care. I've heard just in the last couple of months, folks in Pennsylvania and throughout the country where that's the reality. They've had to give up a career, as many of you have experienced yourselves. Can you say more about how expanding these services can benefit family caregivers, which is as we heard a testimony earlier today, is in the tens of millions. So how can these services benefit the family caregiver, but also all family members generally?
Yes, a couple things, Senator. One is the need for respite care, right? Often family members are just completely overburdened and need someone to come in and provide that services. And another thing I have seen, especially in the rural areas, all right, there's a need for family members to become paid attendants, and because there's no other service available in that area in regard to agency, attendant care, or whatever. So it's important for those family members to be recognized as legitimate home care attendants and get paid for that services. And I've seen that quite often because it just is unavailable. And it's very important how essential is family members to providing attendant care services to their members who are disabled. And we don't often recognize the importance of that.
Theo, thank you very much for that response. I know we're still juggling a little bit. I know that Senator Warnock was, I think, connected, Senator Rick Scott as well. I'll ask another question.
Mr. Chairman, I have a question, sir, if you want me to go with a question.
Yes.
Thank you, Mr. Chairman.
Scott, thank you.
Yes, sir. I know you have your hands full, and I'm happy to try to lighten a little bit of that load because Ms. Blunt hasn't answered enough questions for me yet. So I have a question for her. I see Mr. Brady over there laughing, and I keep talking to my South Carolinian, but she is gifted, and I am blessed to have her as our witness. You served on a task force for South Carolina on long-term care. Now, I will say that this issue, as I've talked about my mom a lot because she is my American hero, and but I have spent several years in the industry selling long-term care policies. So this issue for me is something that I have personally thought about for 20 plus years, maybe 25 years or so, having been in the industry as a pup. I was only 2 years old when I started, by the way. And literally I have spent some time thinking about what could make aging gracefully better. And you served on that 2014 state task force on long-term care. What's changed? And what recommendations would you suggest that we as a committee, as a Congress, and as a nation embrace or at least consider?
So it was a privilege working on that long-term care task force, and we still, are meeting today because that process was like a strategic planning process around long-term care in the state of South Carolina. And the first step was actually getting all of the stakeholders, getting us all to the table and actually just talking and getting us to work together with regards to policy and program development. Because at the end of the day, we do cross. So it's important that we come together and, the right hand should know what the left hand is doing so that we can work together and at the end of the day, provide a seamless transition of services for our seniors. What came out of that, as you alluded to with SC Act, well, earlier, prior to it being Get Care South Carolina, we had South Carolina Access. And that's because, people were looking for that one-stop shop that you referred to. And as a result of that task force coming together, that's how we eventually got to having Get Care South Carolina and, starting to put together marketing behind it and educating our community about long-term care services. So many other things have come out of it, partnerships. We at the area agency, we're working with our Alzheimer's Association, we're working with AARP. We're just working with a lot of organizations who are our stakeholders, who we rely on to help us think differently. Because, oftentimes, we've been thinking one way for so long, but that may not work right now.
Right.
We need to change our thinking. Again, bring us together, having us talk and having us collaborate. The workforce issue, that has been, especially with the home care, we've been talking about our paid professional direct care workers. That has been an issue that we are trying to tackle. And like I said, we came up with 30 recommendations, but I'll tell you, the real work came when you had to prioritize those recommendations, and bring consensus. But again, just bringing down those barriers and us talking and working through this complex long-term care system in our state.
Well, thank you, Ms. Blunt. I will say that when I was selling the long-term care policies, and I do think we should spend some time at some point talking about the importance of helping those who can afford the long-term care policies and things that they can do to hopefully prevent the Medicaid depletion of your resources is an important part of the consideration, making it easier to digest, whether it's using the 125 platforms that allows for these policies to be tax deductible, or something that actually encourages people to make a decision about long-term care assistance when they're in their 40s, when it's pennies on the dollar, versus their 60s when it's the expense is exorbitant. I didn't sell any policies in people, of course, in their 60s because it's just too expensive. But in your 40s, early 50s, this is an affordable alternative that keeps you at home or makes you the decision maker and not someone else. So that's a really important part of the equation that we should find a way to encourage a public-private partnership. I will say that when you think about those days, the activities of daily living, the 5 to 7 activities of daily living that are trigger your care, is really important for us to assess how we deliver on the promise of high quality care assistance in any form or fashion. And I think that's an important part of the formula that we still have to work through. Mr. Chairman, I note that my time is down to 0+3, so I will turn it back over to you, sir, and happy to ask another question if we have members that are waiting.
I have to tell you, Ranking Member Scott has been right on the button with his timing today. I was going to give him another minute or 2 or 5, but now one thing I've learned, and I see Senator Warnock, if he's ready for questions, we can turn to him. But one thing I have been informed about is these technological challenges today are not only the Aging Committee. This is a Senate-wide internet issue. So we might have some senators that can connect by way of audio only, but if Senator Warnock is able to connect by audio, I will turn to him next because we can see him.
Well, thank you so very much, Mr. Chairman. I'm glad to be here and glad I could get on the internet to address the issues facing our caregiving economy. I've long been a big supporter of Medicaid expansion. Medicaid is the primary source of coverage for long-term services and supports in the United States, accounting for 52% of all spending on long-term care nationwide. The majority of the spending goes towards the Home and Community-Based Services Program, HCBS, which typically involves assistance with activities of daily living like cooking, bathing, other types of housework. These critical services enable aging individuals and people with disabilities to remain in their own homes, to stay active in their communities, to lead independent lives instead of moving to institutional settings, since most Americans would prefer to receive service and supports at home. Ms. Pooh, as you know, unlike nursing home care, state Medicaid programs are not required to cover HCBS care at home, which means the kind of at-home care Medicaid recipients can get from this program varies from state to state. Can you speak to how this patchwork leads to gaps in coverage across the states?
Yes, thank you for the question, Senator. The fact that home and community-based services, unlike facility-based care, is optional and not mandatory. It means that states can cap how many people they serve and limit the types of services offered. And this leads to some states having long waiting lists and families not being able to get the full array of supports and services that they need. And even if they get pulled off the wait list, they may still not get the services that they need. And that, in addition to variation in pay and protections for workers that provide home and community-based services, leads to a system that is complicated to navigate, leaves many waiting with nothing, and some without what they need. And in Georgia, for example, there are 8,000 people on waiting lists for this very reason, Senator.
Right. And it's an issue I've been working on for a while and continue to work on. Can you speak about what Medicaid expansion in Georgia and in the other 11 states that have yet to expand Medicaid, what would Medicaid expansion mean to providers, and how would that benefit home care workers?
It's incredibly essential. It is so well documented that Medicaid expansion will improve access to healthcare, health outcomes, increase financial security due to the reduction in share of health costs. It will improve economic mobility because it's easier to go to work or to look for work. For example, adults in Ohio and Michigan reported that the coverage via Medicaid expansion made it easier for them to look for work or go to work. And 16% of home care workers lack health insurance. 43% rely on public health care coverage, most commonly through Medicaid and Medicaid expansion. Medicaid expansion under the Affordable Care Act would benefit more home care workers, providers who rely on Medicaid for their health insurance.
So providing care would actually enable people to work, which is an interesting observation, where we have folks putting the work requirements as a basis for getting the care. And you're saying getting the care actually enables people to work. Is that correct?
Absolutely. That's right, Senator.
Thank you so much.
Thank you, Senator Warnock. I want to give people a sense of where we're headed next. We're alternating, obviously, from one side to the other. I'm told that Senator Braun might be available, at least by audio. If he is not, I will turn to Senator Rick Scott and then Senator Gillibrand. So, Senator Braun, are you connected or not? Okay, doesn't sound like it. Senator Rick Scott will be next.
Thank you, Chairman. First, I want to thank Ranking Member Tim Scott for his report on home and community-based services reform with a focus on self-directed care models. We have that in Florida, but we call it the participant-directed option. When I was the governor of Florida, I finished about 2.5 years ago. We made a series of reforms to our Medicaid program and provided more home and community-based services and benefits to our Medicaid enrollees. We went statewide with our Medicaid managed care plans, As part of what we were able to add additional benefits, such as home delivery of meals, housing assistance, which may include rent, utilities, or grocery assistance, and cellular service. We were able to help people maintain their health and safety before they got sick to go to the hospital without the constraints of what is or isn't traditionally covered services. And we're able to empower our enrollee members to receive care from an approved home health agency or from a friend, neighbor, family member, or other trusted caregiver. So I look forward to working with the committee, and I want to thank again Ranking Member Scott and this committee on replicating this across the country. So my first question is for Ms. Blunt. How can we work to make government more efficient? Beneficiaries receiving home care are typically dual eligible with Medicare and Medicaid. My experience is these programs don't talk to each other. For example, a neglectful attendant might cause the beneficiary to go to the hospital. These Medicaid costs are absorbed by Medicare, but the Medicare program doesn't necessarily share this information with the Medicaid program. And we lose part of the feedback loop on care and measuring quality, or in this case, substandard quality. So how can we better integrate these services so we can detect substandard care? How can we better measure service quality and outcomes? How do you make sure we get a good return on our tax dollars? And would you consider inadequate coordination care to be a big problem, and perhaps maybe the biggest problem in effective management for Medicare, Medicaid, and other Americans Act programs?
Thank you so much, Senator Scott, for that question. You know, it is one of the frustrating things that we see on the local level is, you know, we don't have the ability. It all starts with our data systems. Being able to track data, systems being able to talk to each other. And if we have the ability to, you know, when we do intakes and we're doing initial client assessments, you know, if we have the ability to collect that baseline data and then be able to report on the progress, report on what we are doing, identify and show the changes that we're making, then I think we'll have a better system in place overall. And you alluded to, yes, the system, the long-term care system is fragmented, and that presents a challenge because, you know, we're not able to talk to each other. And we want to make sure that we are utilizing our resources as efficiently as possible and not double serving someone or, you know, duplicating services and efforts. We want to utilize our tax dollars as efficient as possible, but it all starts with our data systems. And I know that's a challenge for us here in our state because we can show outputs all day long. We can show the number of meals we provided and the amount of transportation we provided, but we really need to be able to show what difference our services are making and how we're keeping people out of hospitals and how we're delaying long-term care placement.
Thank you. So Ms. Blunt, one of the challenges of caring for our seniors and any vulnerable population is the potential of abuse and neglect by caregivers, our personal attendants, and then the fear of the patient of speaking up. Abuse can have visible signs, but neglect could be an attendant who shows up but does sub-minimal effort, which may be, as you know, harder to detect, but has the potential to put the beneficiary into eventually a health crisis, or a new wheelchair ramp that looks usable but might not be up to code. Can you speak to how we can protect our seniors from any potential harm and build in accountability, and how do you handle these challenges in your area?
Certainly, you know, it's about training and educating the community, making this issue, raising awareness to this issue. Again, we just celebrated World Elder Abuse Awareness Day on June 15th. And we partnered with the City of Charleston and the Medical University of South Carolina Center on Aging to really promote elder abuse awareness. And again, it comes down to the training. We were able to partner with the City of Charleston and train police officers on investigating allegations of abuse. And so it's so important that we all come together because it's such a huge and complex issue.
Thank you. And my last question, Ms. Blunt, is with Medicaid home care being a single-payer, government-dominated market, ensuring the buyer is getting a good value for their money can be pretty challenging. In Florida, we've worked to address this by tying choice to the patient, by allowing them to direct where their Medicaid dollars go, giving them the ability to hire and fire their personal caregiver if they wish. So what are some of the ways you think a state can evaluate the quality of home care services? And what are you doing in your state?
So what we are doing, okay, so what we are doing in our state is we are, it's about talking to the individual, making sure we're doing the monitoring, that ongoing monitoring, and speaking with the senior, making sure that they are getting the care. It's about quality assurance monitoring and making sure that everything lines up. And we don't reimburse. I know with Older Americans Act funds, we don't reimburse if we don't have all of the documentation in place. We don't reimburse if we cannot confirm that the services were received by the senior. So that's just briefly, kind of what we are doing here in our office.
Thank you. Thank you, Chairman.
Thank you, Senator Scott. Senator Gillibrand.
Thank you, Mr. Chairman. Thank you so much for your testimony and for your leadership. I'm extremely grateful for all the work that you've been doing for the communities in New York and across the country. We know that paid leave, paid family medical leave is a crucial necessity for workers and for families, especially when a family member has a health issue. We know that a national paid leave plan would positively boost the economy as workers spend their wage replacement income that they earn, leading to further job creation and labor income for workers in various goods and service sectors. Widespread lack of paid leave disproportionately affects women of color and lower income workers who are less likely than other workers to receive paid leave benefits from their employer. Do you agree that a national paid family and medical leave plan, such as the one proposed by President Biden in his America's Family Plan and My Family Act, helps address the overwhelming growing demand for caregiving support and long-term care?
I absolutely do agree, Senator, and thank you for your leadership on this issue. It's so essential for the 48 million working family caregivers who work full-time and spend more than 20 hours a week caring for aging loved ones or loved ones with disabilities. They need the ability to have time and take leave to care for the people that they love when they need to. For the care workforce, the essential workers who've been keeping us all safe, taking care of the people that we love, as home care workers, as domestic workers, they need paid leave in order to take care of their families so that our caregivers can care for those that they love too. It's absolutely essential infrastructure.
Thank you. Thank you very much. When it comes to family caregiving, how else can we provide the financial support that they need? I co-sponsor the Social Security Caregivers Act, which would create a credit that could be used, added to an individual's earnings to calculate their future Social Security benefits. I also have the idea of making full-time caregivers eligible for their own Social Security payments and checks. Are these two ideas that you support, and do you have other ideas that we could consider and perhaps legislate?
Absolutely. I support both of those ideas. And I also want to note that investing $400 billion in Medicaid home and community-based services is also supportive of family caregivers who need respite care and need support. Oftentimes, care for the aging and people with disabilities is an all-hands-on-deck situation and requires both family members and home care workers. And I certainly support expanding access to respite care of all sorts, additional cash assistance to cover the costs of caregiving, and more assistance in navigating all of these programs and services.
Thank you. That is extremely helpful. For Mr. Bratty, how do the diverse needs of the population that depend on home and community-based services, including older adults and people with disabilities, impact the need for availability of a wide range of home and community-based services? And does our care infrastructure and workforce meet all the needs of all the people with disabilities? Are people falling through the cracks?
Yes, Senator. Certainly people are falling through the cracks. I think it's important for us to also look at some of the most difficult things in regard to support services, such as transportation. That is affordable, accessible transportation. That is very key. often assistive technology and technology is lacking. People with disabilities benefit strongly with assistive technology. Often doable medical equipment is not provided. There's often caps to that by insurance, Medicaid, and often insurance companies. They practice the thing of not medically necessary. Example is twice my insurance company denied me and said my power wheelchair was not medically a necessity, and obviously it is, right? But I had to protest just to get my motorized wheelchair. So those are the kinds of things that often fall through the crack that unfortunately people are not aware of. And a family member will go in their own pocket to provide doable medical equipment for their child, because that's what they do. They take care of their children with disabilities. Any parent would do that. And so they just don't know how to fight insurance companies often.
Well, thank you so much. And thank you all for your testimony today. I'm very grateful for your leadership. Thank you, Mr. Chairman.
Thank you, Senator Gillibrand. We'll turn next to Senator Rosen.
Thank you, Chair Casey and Ranking Member Scott, for holding what I consider such an important hearing, so heartfelt. All witnesses, thank you for your work and everything that you do. As many of my colleagues know, I stepped away from my career as a computer programmer to take care of my aging parents and my in-laws. I was lucky enough to have them live nearby, and they all got old and ill and began their journeys on that road at about the same time. So this issue is very personal to me because I lived through it. And just the same way that so many Americans, they just take on that responsibility for caring for a loved one when they have to. And it's not always something that you can plan for. It sometimes just happens, and you have to deal with it and do the best you can. And so I recently had the opportunity to meet with SEIU home care workers in Las Vegas, of course, hear directly about the work they do and the challenges they face. And in Nevada and across the country, our home care workers, of course, are overworked, underpaid, and underappreciated for the critical work they do. And I want to tell you, in my experience, so many of those workers, those folks who were there for me at assisted livings and nursing homes and hospitals and home care, all of it, they were angels to my loved ones and to me and to my family, and I appreciated what they do. And so given these challenges, the right to organize, it's so important for healthcare workers. I'm grateful to SEIU for all the work they're doing in Nevada. And so Ms. Williams, can you tell me about your experience as an SEIU home care worker, about the importance of your union benefits and the protections you have in a profession that is unfortunately undervalued, and I thank you for the families that you are taking care of.
Thank you. First, I just want to thank Ranking Member Scott for bringing attention to the different portals that different states do have where the clients and the caregivers can connect directly. But I am blessed with the union, and a lot of times we overlook the simple things. As I was listening to you all, that I have come to, expect, because I receive it from my union. I receive and have won, retirement and health benefits and wage increases, and the list goes on and on. But when you're having amazing people like Senator Scott's mom in other states doing the same job, or my mom in Arkansas doing the same job, but they're not being valued, it's heartbreaking. Mm-hmm. It's heartbreaking because we are the maintainers of life. And when we are maintaining that life, like I said earlier, we're giving the ability for the rest of society to continue forward. And for a lot of our clients, some of them are able to work or continue forward with what they were doing because now they have that extra balance to rebalance them from where they were normal people given an unexpected new norm, And that caregiver is like that missing fourth wheel of their car that comes in and basically rebalancing everything. And so when you're giving that fourth wheel enough air to do its job properly, a union, it makes the ride for all of us even smoother.
Thank you. And speaking of smooth rides, I want to talk about incorporating palliative care into a healthcare, caregiving plans, because I dealt with this with my mother who had terminal cancer, lung cancer, and she needed palliative care. It wouldn't be curative, but it would remove some of her pain. Because of the challenges I had, I launched the Bipartisan Comprehensive Care Caucus to raise the benefits of palliative care overall. And so, Ms. Blunt, as an executive director of an area agency on aging, are any of your caregivers trained in palliative care, and how do you collaborate in that space? And
Sure. Thank you for that question, Senator. So yes, our caregivers are trained in palliative care. We work in South Carolina, we work with DHEC licensed agencies, and so they have to ensure that training requirements are met. But at the Area Agency on Aging level, we do collaborate with hospice organizations because we have several in our community that are doing really, really good work. And so they partner with us in providing that training and conducting that outreach and just making sure that these services and that caregivers even know that that's an option, a service that they may be accessing.
well, again, my time is up, Mr. Chairman. I just want to really thank you, you and Ranking Member, for having this hearing, for recognizing that this is an issue that touches every family at some time in their life and people that they love, and we need to be sure that we support everyone the best we can. Thank you.
Thank you very much.
I want to thank Senator Rosen. Ranking Member Scott, I know I was going to try to connect. Or see if we could connect with Senator Braun. I know he's been trying to connect.
He has.
In terms of audio, what do we know about that?
No luck so far. I know that my staff has been reaching out to his, and we have not had any success so far. Miri, I don't know that we have. Senator Braun's not available at this point technologically.
Yes, we understand he's unable to connect.
He's unable to connect, sir.
Okay. Well, Ranking Member Scott, I think I will turn to closing.
Okay.
That's okay.
Yes, sir.
Well, thanks very much. I just have a couple of comments, and I'll turn to the Ranking Member for his closing comments. But coming out of the devastation of this pandemic, we've had a lot of challenges, obviously, for families. I think one thing that's, in my judgment, an obligation for those of us in the House and the Senate is to do everything we can to bring about not just change in light of this pandemic, but transformative change both for families facing these challenges that we've talked about today, as well as the workforce. The American Jobs Plan includes, as I mentioned earlier, a historic investment in what I think is a great American idea, home and community-based services, which a lot of Americans receive already, but a lot more don't unless we make this investment. This investment will ensure that older adults and people with disabilities are able to receive the services they need to remain independent and to be active members of their communities. We must make this investment to strengthen and fairly compensate a critical workforce that's been neglected for far too long. I think the pandemic, as it did on a number of fronts, highlighted that lack of investment and highlighted the essential nature of the work done by those caregivers. So I look forward to working with all of our colleagues to advance the policies we've talked about today. I do want to thank in particular our witnesses, Ai-jen Poo, Stephanie Blunt, Brittany Williams, and Theo Bratty. And now I'll turn to Ranking Member Scott for his closing comments.
Thank you, Mr. Chairman, and thank you for handling with grace the challenges from a technological standpoint that the committee was faced with today. For most of us, it seemed to be a very small challenge. Recognizing your hard work behind the scenes, I realized that it's infinitely more than a small challenge, but you handled it quite well. Thank you to each of the witnesses who invested their time and frankly, to those who've had really challenging yet inspirational stories. Thank you, sir, for your amazing testimony and frankly, your life's journey that tells us that all things are still possible, no matter the challenges, whether it's a football accident at 15 years old. It's just a powerful story that we all benefit from hearing. Ms. Williams, thank you so much for recognizing my mom and her sacrificial service to others. And one of the reasons why I think I'm a United States Senator today is because I had such a wonderful model that I was able to follow from a very early age. I'll say this, that Chairman Casey and I probably disagree on a lot of issues, but his way that he handles himself makes me so proud to be the ranking member on this committee. And while we may not see the same solution, we typically see the same problem. And the beauty of America is that we can take different paths to the same problem and hopefully open eyes that we are all in this together. I would say that the American Jobs Plan is a federal government-centric approach to solving needs that I consistently disagree with. I see the same need, but I think that the community and the local solutions are consistently better for the patient and the caregiver. So while we will disagree on some of the solutions, I do think the importance of agreeing on the problem should not be overlooked or understated. Patients and families want flexibility for patient-centered, self-directed care, not government-directed bureaucracy. That is really the most important point for me. That in fact, we believe that the federal government spending more in this area is an important consideration and frankly, an important resource. We would want it to be directed to local organizations to provide the highest level of care. There's a reason why the things that we care about most aren't in Washington. They're in our own houses, it's our families. And to the extent that we can provide more resources, more information, more collaboration from the local level up and not from the federal government down, we believe will provide the highest continuum of life and care. So, Mr. Chairman, I thank you for this hearing. I thank each panelist for your expertise in providing what we needed to hear. And I do think that we will find better solutions when we're working together for those solutions, even though we may disagree on how to get there. Mr. Chairman, I yield back the balance of my time.
Ranking Member Scott, thanks for your statement and thanks for working with us on this hearing. I think we can both commend and salute our staffs. On my side, represented by Stacey Sanders, who had to do the really hard work on not just the hearing, but on the technological issues. So we're grateful for their work and others who helped us get through the challenge we had. I also want to thank the ranking member for sharing not only his thoughts and his views on these issues, but sharing his mom's story. It just shows that so many Americans have had these experiences, and we need to benefit and learn from all of those stories. And again, we want to thank our witnesses for contributing both their time and their expertise. If any senators have additional questions for the witnesses or statements to be added to the record, the hearing record will be kept open for 7 days until next Thursday, June 24th. So thanks everyone for participating today. This concludes our hearing.
Thank y'all.